The Public Health Accreditation Board was established in 2007 for the purpose of developing and implementing a national program of accreditation for health departments. We have accreditation categories for state health departments, for local health department for tribal public health departments, and for territorial public health departments. Our accreditation program is different than some others that you might be familiar with in a variety of ways, and one of those is it's voluntary. So you and your health department have a choice about whether you want to go through this process or not. The other thing that distinguishes us somewhat from some accrediting programs is that we're about advancing the quality and performance of health departments. So the answer to the first question on the test at the end of today is, why would a health department want to be accredited? Because you want to have somebody besides you to say you're doing a good job. And you want to be able to put your health department's work out for review against national standards and to be able to say we're doing a good job. Or if there's one or two things that need to be examined further so that you can do a better job, then that opportunity presents itself. We do have national standards that were developed from a combination of the evidence for what works in public health. For example, in communicable disease control, there are some things we know that work. In environmental public health, there are some things that we know that work from science and evidence. In other areas of public health, we have best practices as opposed to research or evidence. And our standards are a combination of those that have also been vetted and tested by health departments all over the country. And so we say that, and we are a consensus-based organization. So the second question on your test, who made up those standards? Health department people did from all over the country. We have an assortment of committees and work groups that help us to determine what the best standards for public health is. And we use those standards and we change them as public health practice changes. Since 2007, we've been developing and testing the program. We rolled it out to receive our first applications in September of 2011. And in February of this year, we accredited the first ever health departments in the country, and the names of those are on the slide here. There are two state health departments there, Washington and Oklahoma. And the rest are local health departments of varying sizes. So I want you to see that even in these first 11, that we have a number of types of organizational structures. So here's the third question on your test. FAB's going to tell you how to run your health department and how it should be organized, how many board members you should have, what the salary of the district director or the health department director should be. We're doing none of that. We don't have any evidence or really even best practice to guide us in standards about that. But we talk about the health department's capacity to carry out the functions of a health department, and I'll show you examples of those standards in a little bit. When I prepared these slides for this presentation, there were 131 additional health departments that were going through the accreditation process. Today there are 134. Every week we get some more. And yes, Georgia is colored in because somebody in Georgia has actually applied for accreditation. I can't tell you who that is because when we were developing the program, the health department said, when we start this, will you keep the names confidential until you actually make the decision? And we said yes. So we talked to the first 11 and said, what drove you to be interested in accreditation? They said in their political environment where they are right now, their elected officials and the population they serve are interested in good government. Well, aren't we all? And so the transparency that comes with knowing that their work has been placed for review against national standards and the accountability that comes from that were values to them. Others said, as I said at the beginning of this presentation, that most other governmental and health-related services are accredited. Some Board of Health members that we talked to said that for them it was the first time they had sat down with their health department leadership and actually set some priorities about what they should do. For some, it was a commitment to improving their services. For other health departments, they said it was about increased public engagement. We have several standards where we absolutely require the health department to demonstrate how they work with their community. For some, they told us that it increased the staff morale. There is also the potential for increased funding in the future. Now, FAB's not in charge of that, but we've been told by private foundations, by the federal government, that there could come a time in the future, not yet, it's way too early, when you get a grant application and you have two that are otherwise equal, and one is from an accredited health department and one is from a health department that isn't accredited. Our process is not terribly different than any other accreditation process. We have a pre-application. We ask health departments to just let us know that they're thinking about applying in August or October. Step 2, the application is binding, and that's when the health department says we're ready. And they submit that application, and then they begin the process to go through documentation, selection, and submission. For those of you who might have worked in an accreditation process in the past, that's a lot like a self-study. So we ask the health department first to tell us, to give us evidence from their perspective about how they think they're meeting a standard. And while they're doing that, we will appoint a team of 3 site visitors, and then they will make a site visit. It's usually a couple of days, and the purpose of that site visit is to see the facilities, to talk to you, those of you who are governing board, to interview some of the community leaders just to validate what they've seen in the documentation. A report's prepared, and then it goes to our accreditation committee, which is composed of some of our board of director members from the Public Health Accreditation Board and some non-board members who are in the business of directing public health. And then a decision's made. Now here's the good part, I think. Here's where we're all so different. The final decision is either accredited for 5 years or not accredited. If it looks like a health department is almost there but didn't quite make it, then we give the health department one more opportunity, and that we ask them for an action plan to address the issues that the site visitors and the accreditation committee thought were problematic, that they weren't quite ready. And the health department can choose to provide that action plan or not. If they do, they have 90 days to submit it. It's reviewed. If it's approved, then they have a year to do those things they need to do in order to be accredited. We do have 3 prerequisites that we're asked to come in with the application. And these have fancy titles like Community Health Assessment, Community Health Improvement Plan, and the Strategic Plan. What we're looking for there is that the health department has engaged in a process to assess the health status of the jurisdiction it serves. And it's worked with its community to set some priorities in the plan. Whether those are done by the health department or not, or whether they're funded or not, some of the best health improvement strategies don't require funds. They require agencies to work together and to work with the community. And we don't tell a jurisdiction what needs to go in here. We ask them to tell us what kind of process they used and what they came up with. And then the health department strategic plan is that. It's what is it that the health department is going to do over these next few years. The reason we require those is we like to know that the health department knows what's going on in its jurisdiction, and that it's taken that leadership role to work with other governmental and private partners and community organizations to improve the health of the citizens that it serves. That also forms the basis for the rest of the review. So you can imagine if you were a site visitor and you got a community health assessment and an improvement plan from a jurisdiction, and let's just say that plan said that obesity was an issue. Would that be real in Georgia? It is in my home state. So the Community Health Improvement Plan should have some goals and objectives, not just for the health department, but schools have a role in that. Governmental organizations, other ones have a role in that. Nonprofits have a role in that. And so the Community Health Improvement Plan talks about that. Then there are other places in the standards and measures where we ask the health department, give us examples of health promotion or health education. Well, wouldn't you expect to see something about obesity? Our standards and measures are based on a framework in public health that you may or may not be familiar with. Some Board of Health members are and some aren't. But all specialties within health have frameworks that they work within. And the Institute of Medicine in 1988 said around the circle that there are 3 core functions of public health: assurance, assessment, and policy development. And then later some additional work was done by the CDC and others that said within those core functions there are 10 essential services, and that's what you see around the wheel. So that was pretty familiar language in public health, so we chose that as the organizing framework for the standards. We have 12 domains. I just told you there were 10 services. So let me tell you why there's a disconnect there. The 10 essential services did not address management and administration nor governance. The first 10 relate directly to the 10 essential public health services. So we have the 12 domains, and under each are a few standards. And then under those are measures. Those are actually the things the health department has to do, such as the illustrations that I've given you. And they show us that with documentation that we give them guidance about, so they don't have to reinvent the wheel. For the most part, health departments provide documentation of things they have already. They already have many of the documents that we're asking. This is domain 12. This is the domain that says that the health department should maintain capacity to engage the public health governing entity. Now, do you think that's important for a health department to do? Sure. And so under that domain, we have 3 standards. Maintain current operational definitions and statements of the public health roles, responsibilities, and authorities. Every health department has its role and authority described somewhere. It may be in state statute, it may be in state rules and regulations, it may be in local rules and regulations or ordinances, but somewhere, this is where we say, health department, we want to know what it is that gives you the authority to do the things you do. And then the second standard says that they should provide information to the governing entity regarding public health and the official responsibilities of that health department. And then the last one is encourage the governing entity's engagement in the public health's overall obligations and responsibilities. So let me show you how they play out. I won't read all of these. But here's how our standards and measures are set up. We have the standard at the top, the measure, and then purpose and significance says why it's included, why it's important. And then the required documentation is what they give us as their self-study or their evidence. And then the guidance to the right there is giving the health department some hints, if you will, about what they may already have that can be used to demonstrate their conformity with this measure. So here's the one that says maintain current operational definitions or statements about the governing entity. And the required documentation is we have a written description of that governing entity's authority and the description of the governing entity, how the health department communicates with that governing entity, and then how the governing entity works with the health department. So for the NALPO meeting last year, we pulled some of the letters of support for accreditation from some of the governing entities, and when I was asked to do this presentation, it was noted that that was of interest, so I thought you might be interested. We just randomly pulled 24. The application that comes in for accreditation has to have a letter of support from whomever hires the director of the health department. And so in this particular case, we pulled 24, and those the chair of the board had written those letters. 5 of those were, we pulled 42. 5 of those were the chair of the county commissioners. 3 were the director of an umbrella agency where the health department was part of social services or environmental health or whatever. 2 by the governor, 2 by mayors, and 7 others. And what that 7 other is just some unusual configuration of local government. 3 also included a resolution from the Board of Health where they spread it on their minutes that they were authorizing the health department to move forward with accreditation. And I won't read you all of these bullets on the slide, but from those letters, here were what these board members said about why they supported accreditation. And you can see it carries that theme still forward with open, accountable, transparent, model in the community, learning from the site visit and the review on how to run a better health department. So those boards of health also said that when it works, accreditation is a priority for both. So I told you I wanted to talk also about Domain 11, the part about managing the health department. In that domain, we have standards and measures that speak to what does the health department's budgeting and accounting system look like. We don't say what it must look like. We ask them to describe it and to tell us if it works. So it's a good opportunity just to sit down and think through whether what the health department's doing with regard to the way it manages its budget, an accounting system, whether it needs to be updated in any way. We also asked to see a copy of the last fiscal audit. We asked that they have current and up-to-date human resource policies and procedures. We also ask about the information system. Does it work? Has the health department, what's their plan for keeping it current? But also we're using computers for everything. We also ask them, as you know, to keep the board informed and engaged, and then we look at the facilities to see if they're ADA compliant or if they're exempt from that because they're on the National Register of Historic Places. We've actually visited a few health departments that's the case. And in that particular case, rather than to demonstrate ADA compliance, Americans with Disabilities Act compliance, they demonstrate how they serve people with disabilities when they're in a building that was built in the 1800s. We have a number of resources available. Everything, I gave you some examples that I thought would be the most pertinent for you. All of these are on our website, can be downloaded. They're free to health departments as well as a number of webinars. That's just a snapshot of our website. And we also, if you'll notice, if you can see on the bottom right, a little green bar, we have a login for accredited health departments. So once a health department is accredited, they have a password protected login to our website, and there we connect them with each other so that they can continue to inform each other and we can continue to inform them about important changes in public health that they need to be aware of. Now, yes, there are fees. We couldn't have this program like any other accrediting program if we didn't have fees. What I want you to know, though, is because we do also receive grants from the Robert Wood Johnson Foundation and from the Centers for Disease Control, then the fees that we charge the health department only cover the cost of doing the review. So the training for the health department, the site visitor travel to your health department, those kinds of things. The fee structure is based on the size of the population covered by the health department. You can pay it all at one time. You can pay it in 3-year installments, or you can pay it in 5-year installments. And we do that in an effort to try to ease the burden on the budget as much as possible. We do have special fees that apply to centralized states, so let's just say Georgia's kind of a hybrid, but let's just say that if a district in Georgia decided to apply, then the population for that district is added up for the population, so you don't add up every population within that. I know that should add up to be the same, but given the fee formula, it's not quite the same. The top 10 myths that I hear about accreditation, we hear the first one a lot. Someone in Washington, D.C. is deciding what public health does at the local level, and I've already spoken to that. We are helping you to assess what your health department does. We're not going to tell you that you have to have X program or Y services. We're going to talk to you about, in that framework, what public health does and whether your health department actually does it or partners with somebody else to get it done. That's what counts. The standards are too high for our health department to meet. We've not had a single health department who's either in the process or who's finished it to tell us that. Accreditation is all about health reform. That's all we hear, isn't it, about health reform? And I had a gentleman in the middle part of the country the other day to say, I don't want any part of it because it's all about health reform. We have nothing to do with health reform one way or the other, and we've been working on this for the last 10 years. It costs too much. Well, it costs more than nothing, and this is new. And so, you know, health departments, many health departments have been charging fees for their inspections for environmental health or food, restaurants, whatever, for a long time. So I find that most health departments, while it's a shocker to think about adding accreditation fees to the budget, most health departments get the fact that you got to cover your cost if you're going to be in business. And so we're a nonprofit organization. We don't make any money off this. All I need to do is be able to cover the travel of those site visitors and to keep the lights on a little bit at FAB. The standards were developed by people who don't understand public health. I've spoken about that already. It might as well be mandatory. Well, I know that a lot of people feel like that it will eventually be mandatory. My board has gone on record to say you don't mandate quality improvement. No clear return on investment. I get asked all the time, so what do I get for this? Well, I hope you get a better health department, and I hope your staff get a better understanding of what they do to improve the health status of the community they serve. We don't have time, staff, or money to do anything else. Well, that's probably true, and that's why I said what I did about it must become a part of what staff do and not a separate program or activity. It's a federal plan to get local health departments to close or merge. Well, if it is a federal plan, I have to tell you I haven't heard that. It is a plan to get health departments to do a better job. And if that means that really small health departments need to strengthen their working relationship with their health department in the next county or the next parish, probably needs to be thought about, but that's not the same as closing or merging. That's a local decision. We're going to leave it with you guys to do that. And then my personal last favorite and the last one, if we wait long enough, it'll go away. I'm not really thinking that public health accreditation is going away. At least I hope not. But what I hope you've heard today is it should be something that you do and your health department does because you want to. It should be done at the timing that you think is right. And it's not something that we force on any health department or their staff or any board who's not ready to do it.